Hello everybody, it's Thursday again, and I know it's 2 weeks since we saw you, but we're the infant feeding team at the John Radcliffe Hospital. I'm Naomi and this is Alex, my colleague. We're both midwives, and we are doing about an hour session as usual on questions and answers on anything about infant feeding. So that means that anything to do with feeding your baby. So you might be pregnant and you might want to know a few questions about what happens before, during pregnancy, and also when you have your baby afterwards. You might have some questions. If you're breastfeeding and struggling, you might have some questions about that, and also if you're formula feeding, so or weaning even. So any aspect at all of any stage of your journey that you want to ask questions about infant feeding, this is what this session's for. We're not here to answer questions about scans, pregnancies in general, or your appointments or visiting times or anything like that. That is pertinent to the Ask the Midwife session, or you can ask your own midwives those questions, or refer to the Trust website, which will have the most up-to-date information on it. So we won't be answering questions about things outside of infant feeding today. So I hope you're all right and carrying on as before. We realise now that it's a year really since we locked down practically, and that means that the mums that had their babies a year ago are probably thinking about going back to work or having gone back to work. And in that time, how much contact have you had with other mums and babies, and got to know local people in your local areas, and how hard it must be for you all, and how have you all managed with that, because it's really difficult. It's such a big part of your postnatal journey and antenatal journey actually. You meet other women local to you in classes and things, so that you can meet people near you to meet up afterwards, and that's all been gone this year, so it's been really tough times. So just acknowledging that really, nothing else to say, just acknowledging that it's a whole year, and how hard it's been for everybody, and how well all of you have done with the circumstances that we've had. It's been very difficult. So well done everybody, and we look forward to seeing lots of new mums coming in. We have had a bit of a baby boom, which is why we didn't see you last week, because we've had lots of COVID babies, shutdown, lockdown babies, and the impact was we were busy. And so I think we've had a little bit of a breather. It's still very busy, but it's not quite as busy as it has been in the last 2 weeks or so, 2 or 3 weeks. It's been really full on. So we're very happy to be back and answering any questions that you have. So one of the things that I thought I'd quickly mention, because we've had, just because we're very busy, we've had more people coming back into hospital with postnatal readmissions as a result of weight loss. And one of the first things that when a midwife will ring me and talk to me about weight loss is, have they got the right weight? And so one of the things we say is, did they have a photograph of the baby on the scales in the delivery room? Because that's really helpful if in human error it's been written the wrong way around and your baby comes into hospital and it's not actually the weight that your baby was at birth. You know, occasionally there's human error at 4 o'clock in the morning when it's been a very busy shift. Someone might have written a digit the wrong way around, and we just like, it's really good backup if you are in the labour room and you've got access with your phone. Take a picture of your baby on the scales. It's a lovely memento anyway, but so that we can just check that weight to make sure that it is exactly what you think it is. And so we can look it up and say, yeah, absolutely, that was the right weight, and this is the weight loss that we've got. There is heartache if the weight was wrong and your baby's readmitted. So it's really nice for us if we've got accurate weight as a backup, so that we can say definitely that was what the weight was at birth. So that's just a sort of an add-on. Remember, if you're pregnant and you're thinking about it, make sure that you have got a camera and take a picture, because it's really helpful for us as infant feeding, and for your midwives as well.
Give that to your partners as a job for them to do.
Yeah.
It's not what you're going to want to be doing, because hopefully you'll be resting, sitting in bed, but you're not going to be hopping up and doing the photograph. But your partners will enjoy that role, and you know, and it's proved so useful in the past to have a weight and to be able to say, okay, there was a bit of human error here, and these digits have been transposed, and this baby hasn't lost as much weight as we thought, which is really good. I'm going to apologise because I'm hoping the picture that you've got on screen is better than the one I've got on my laptop, because that's how I check your messages. But we look very fuzzy So I'm very sorry about that. So I don't know if we've got lots of building work going on. So if you hear lots of drilling, there's work going on. We're on level 4 at the moment, and the drilling is going on 5. And every once in a while we can hear it. So apologies for that too. And I wonder if that might be causing a problem with the.
Some of you might have been involved in that last week and the week before, if you've been in, or in the last few weeks. Really, they've been around a while on the ward, and they're still drilling away. So
here they go.
Bang on cue.
Just as I said.
So hopefully you hear us. We'll try and shout.
No, I've seen we've got a couple of messages already, but I'm just going to talk about something else just for the minute while I am. We're coming into the hay fever season, and many women suffer with hay fever. And just to say that just because you're feeding your baby doesn't mean you can't take medications, but it's being sure the medications you're taking are appropriate. So a really, really good website is the Breastfeeding Network. So if you look up Breastfeeding Network, a fantastic woman called Dr. Wendy Jones has written a whole load of resource pages, and they look a bit like this. And they have all the information about medication. So they have information about hay fever and breastfeeding, analgesias and pain relief and breastfeeding, anaesthetics and breastfeeding, things like antibiotics, antidepressant medications, and it tells you which ones are considered safe and the very few that are not. So for instance, when it comes to thinking about if you're dealing with hay fever, and that's pretty awful, antihistamine. So the suggestion is that you go first and foremost for a non-sedating antihistamine. Then you can use nasals or spray and eye drops. So the ones that are sort of considered fine are things like loratadine or Claritin. Zyrtec is another one, Pirites, Benadryl, they're all fine. So those are all alright, and even phenylhexidine is considered fine. The sort of things you really, really need to avoid if you are breastfeeding are any of the decongestants. So anything that has got pseudoephedrine in it, so it is like Sudafed. And what they do is they dry up your mucous membranes, but they also dry up your milk. So if you're a breastfeeding mum, and you take one of those medications, your milk supply will take a knock. So just to have a think about checking out the Breastfeeding Network, avoiding anything that is going to dry out your membranes, like any of these sort of Sudafed type medications, but the majority of antihistamines are absolutely fine. Non-sedating ones will be perfectly fine. So just, being cautious going forward. We invariably say that there is always a medication in those families that you can take, but just be aware and check out the Breastfeeding Network's website, because it is a superb resource and it will cover almost everything. So if you're sitting there thinking, what if I'm on this med, then that's a really good place to go. If you don't find the answers about medication you're on particularly, you can always email us or give us a call, because we've got access to online resources where we can check medications up, and our staff and our obstetricians who are running the clinics like Silver Star and places like that, they will be checking as well, and our pharmacist, we have a pharmacist specific to maternity, is really on board with ensuring medications that are prescribed to mothers are suitable. So, anything to add to that?
No, I don't think so. I mean, it is really frustrating, and I don't think people think that there is a problem, but we do see that it does dry up milk if you take them repeatedly. And it is, but on the other hand, it's really miserable if you've got hay fever, so you can't not take anything.
No.
So, and also your pharmacist will advise you as well, but they're very cautious, so they will be in pharmacies, they're on the caution, and they don't have the access to quite the same level of specifics for breastfeeding as we do. So don't struggle. If you're not sure, just make a call.
Yeah, have a look at Breastfeeding Network, because it's all on there. It's absolutely fantastic. So I have to say, I think almost every few months we get a call from someone who maybe has to come in for an operation and wants to be reassured that they can have anaesthetics, and we can provide them with all that sort of information. So
and it's surprising how many drugs you can safely take when you're breastfeeding. There's very, very few that you can't take. So don't be fobbed off if they say you can't take that when you're breastfeeding. If you're not sure, ring us and get double checked. Send us what you're having, and we will look and get the right answer for you. Yeah,
I don't want to hear someone stopping because they're being given a paracetamol or an aspirin or an ibuprofen or anything like that, because that's absolutely fine. All those sort of things are fine. Catherine Berry's put up here, pictures fine, but we can hear the drilling. Yeah, I'm sorry about that.
And it's quiet on this side.
I don't think we can escape it, I'm afraid. So anyway, sorry about that.
Maybe you won't have hay fever wearing a mask this year. It'd be quite interesting to see if it improves your outcomes. We'll see.
We've got Charlotte's come on, one of our absolute regulars, and she's saying, hi Alex and Naomi, hope you're keeping well and keeping safe. Alicia says hi to you both, and she's grown so much. I know, it's amazing.
Nearly.
Yeah. And Catherine's given us some feedback, so that's brilliant. Emily's come on, she's 39 weeks and, whoops, it's just popped up, some other ones come through. 39 weeks and going to start collecting colostrum now, producing a fair amount already. What's the best way to sterilise the syringe and cup for collecting? You don't need to, so just keep it clean.
You've got clean syringes from your midwife or whatever, then they're fine to use, and you can keep expressing until it's full. So if you do it over 5 days and put it in the fridge, then you can put it in the freezer after that. Then it's fine. You don't need to. And if you're using something like ice cube trays, you can get tiny little ice cube trays. Then you probably wash it really well first, and then it's fine to express into, and then just put it in a freezer bag or something, and then collect it in the freezer.
We don't worry too much about sterilisation when it's human milk. Human milk fights off bacteria, particularly colostrum, and mature milk too. So it is less of an issue, which is why it has such long shelf life. Why it can be out. Colostrum can be at room temperature for 24 hours, and mature milk can be at room temperature for 6 hours without being concerned. And then both of those can then go in the fridge, as Naomi's just mentioned, for up to 5 days, and then into the freezer for 6 months. And that's being conservative because, you know, we've had examples where we've had faulty pumps and it's had a bit of milk in a safety bottle, and that bottle, we've still managed to pour that away weeks later and it's still poured away. So your milk is fantastic and it really doesn't go off in the way other milks do.
I think if you looked at the research that they've done and what bacteria grows in it, there's very little in the research that they've done.
So yeah, just really clean. I mean, dishwashers are good too because they really get up to nice hot temperatures. So, you know, if you've got a dishwasher, that's a good way of going about it. And
you should have clean syringes from your midwife anyway that are in packs, and then you can use those and open them as you need them.
Yeah.
And they're perfect. They're sterile.
So good luck with Emily. Glad to hear you've got so much colostrum. That's brilliant news.
It's a great technique.
Yeah. Jasmine said, hi, how can I increase my supply? I breastfeed for 40 minutes each time and my baby's never satisfied. I've also developed some lumps in my right breast which I believe are blocked milk ducts. I've been trying to massage them for over 3 weeks and they still aren't going away.
How's your positioning and attachment?
Yeah.
How's your positioning and attachment? Has somebody watched how your baby's feeding? Is your baby in the right place? Is it deep enough on the breast? And we go back to this, it's our go-to every week about getting your baby attached really well. And sometimes if they're a little bit central on the breast, you find that they don't drain the breast as effectively, but also they don't ask for the next feed to be made either, and then your supply dumps down a bit. But sometimes it's they just don't get the milk out, and then as the milk's not removed, then there's something called FIL, feedback inhibitor of lactation, which is an enzyme which actually tells the breast to stop producing milk. So if it's not draining the breast well, and there's backlog of milk in the breast, you'll get plugged ducts and things. And lumps, but also it'll stop the milk production as well, and it happens quite quickly. So that's why it's really important to get really good attachment. So it's lining your baby up in the right place, so getting him underneath the breast, nose to nipple, so that they're in an asymmetrical position. So their nose will be lined up and their chin will be in place right underneath the breast, right below the areola. Although people's areolas are different shapes and sizes, that's normal. And then as your baby lifts its head back, its head is free. The nose becomes above, but the chin hits the breast first, and it's still that asymmetrical latch. You can see that it's actually, the baby is going on with the nipple just skimming the gum and going right to the back of the roof of the mouth, so they get a really asymmetrical deep latch, so that they take the breast into the mouth, not the nipple, and then that milks the breast and makes the next feed. So you're looking for that. You're looking at another baby doing the same. You can see how asymmetrical that baby is. It's really underneath the nipple, on the breast, and the chin hits it, the nose is far away, and the nipple is just skimming that gum, and it slides across the roof of the mouth, right to the back of the throat, and the baby has a really big mouthful with full cheeks. And that means that they've got the right amount of breast in the mouth to milk it, so the tongue can then strip the milk out of the milk ducts. And that's baby close. You see how close that chin is, and you can't really see anything. The nose is free, and the chin is really close, got a double chin there and really big full mouth, and then they can transfer the milk properly. And when they're finished, then they'll take themselves off and they'll just fall off and be happy. And your nipples should look the same as when they come off. So it's just making sure that they fall off well when they've had that positioning. So make sure that you really get that asymmetrical latch. Looking at it like this, and actually I'll go that way and then you can see, but the chin is here, can you see? And this is the top of the gum, and it just literally skims over the top and then takes a big mouthful in, so the chin hits the breast underneath. You see how asymmetrical that is? I'm not there. It's asymmetrical, and that's the trick. And it's just the nose really just free, and then it just skims over that gum ridge and goes to the back of the roof of the mouth, and the baby takes it into its mouth there. So it's getting that right in order to strip the milk out of the breast. And if you haven't quite got that, then you get this build-up of milk, and the production does go down, and you get locked ups and lumps in your breast as well. But also your baby doesn't get the right amount sometimes. Has your baby's weight been good? That's the next question.
Well, I think the feeds are 40 minutes each side at the moment. So,
yes.
I mean, that's sort of, we consider a feed to be somewhere between 5 and 40 minutes, but if they're consistently long feeds, then we'd be going, okay, well, let's look at positioning and attachment. Can we make this more effective for you? Can we make this baby feed, more efficiently at the breast? So I think it would be well worth looking at your positioning and attachment. I mean, it's something that can be done on one of these online support groups, so it could be with us, or it could be with any of the other organisations out there supporting you with feeding. It's amazing how much support you can get with positioning and attachment without even having to come in and actually see someone. So Jasmine, I'm not sure how old your baby is. You haven't said on here.
You might find doing something like compression will help as well. It might speed up. So when your baby is suckling, you hold your breast like this, really firm, as far back to your chest wall as you can go. So you can be underneath here, you can be here, you can be there. You can do it like that if you've got free hands, but as far away from the baby's mouth as you can get. And then you hold and squeeze when your baby suckles, and then when they stop suckling you let go, and that pushes milk into the baby's mouth, and you'll see your baby then visibly start glugging more and transferring more milk, and that will help the suckling. But really good positioning will clear ducts, and it will clear breasts, and it will make the right amount of milk, and the feed will be quicker if your baby is more efficient. And if your baby is consistently feeding and not getting a break, then you would question whether the attachment is right and the production of milk is right. Because if you feed for 40 minutes on each side and your baby sleeps for 3 hours, you can cope with that. But if it's 40 minutes each side and then you start again, then that's not right. So the whole picture is really important. And some babies transfer milk much more slowly than others, and some mothers have less volume in their breasts than other mothers. And so it is very unique to you and your baby, that dyad. But it has to work, and your baby has to be satisfied at the end of it, and also pooing and peeing normally, but also gaining appropriate weight. And if all those things are in place and you're getting a break between them, then that's not too bad. But if it's not, then it isn't, and you probably have room for improvement. And as Alex says, there's always room for improvement in breastfeeding, even if it's perfect. So you could probably do a little bit better, because we'd say that to everybody.
So I think it might be worth you reaching out, Jasmine, and getting a bit more one-to-one support, whether that's online or face-to-face, but I think it would be well worth it.
If it's your midwife and you're still under the care of your midwife, then go to get help there, or if it's your health visitor, ask for your health visitor to come and watch you breastfeed, or go into somewhere that she can watch you breastfeed, or get someone to help. But also there's the Abingdon Baby Cafe and the Oxfordshire Breastfeeding Support, but they are very, very, very busy.
Well, there's us as well.
And
so
there's
we can do online support
already
as well. Yeah. So do get in touch, Jasmine.
Yeah.
Make sure, reach out and get some support. I think that would be worth it.
Yeah.
3 weeks is a long time to have blocked out, so it must be quite uncomfortable. Freya's come on. We know Freya and baby Noam. He's 7 weeks now. Wow, he's feeding regularly from the breast. Yeah, from the last 2.5 weeks, but he gets top-ups. express breast milk and formula. For a few days now, he shows a new behaviour. He latches on properly for some time, but then loosens the latch so that he's only on the nipple. So he then sucks and chews, he's often a bit agitated. When I break the latch, he opens his mouth wide and wants to get back on the breast. I'm wondering if there's a sign that the breast is empty. When he does this, I offer the other breast and then repeat this once more, so he feeds twice from both breasts. Any advice? Also, have the feeling that milk supply has decreased in the last week. I only needed to top him up in the evenings, but now he seems to need them from midday onwards. I'm wondering what's happening with the positioning and attachment, Freya, whether you're really getting him on brilliantly right from the beginning, and we had some great feeds when you came to breastfeeding clinic. I'm thinking about whether we can encourage him to sort of keep that deep attachment, maybe taking a more reclined position, so get him on, lean back, so that you've got gravity on your side to keep that lovely big wide mouth that he's capable of. So that he's less likely to start drifting away. Remember, if the baby starts to drift away from the breast, he's not going to milk the breast as well as he could do, and he will clamp because he'll go, I don't want to come off, I want to feed, and so he may get agitated. So I think it may be well worth looking to see whether you've got your wrists well supported, that you've got him in well, or take yourself back, make sure he's lying in against you. If you're concerned about your milk supply, I don't know if you're still doing any pumping, it's whether you add a bit of pumping in just to give it a boost. Now remember, once you've established a milk supply, that milk supply is there and it only needs to be asked for again and it will come back. We've known of mothers who've had babies of a year plus, and they've ended up on, in the children's hospital for one reason or another, and the only thing the baby will tolerate is a breast. And within less than a week, that mother has got a full milk supply, having had a baby that maybe was only feeding 2 or 3 times a day with complementary foods alongside, solid foods alongside, and is now fully breastfed again. So your breast will respond if you ask for more milk. So even if you feel like your milk supply has gone down at this stage, there is absolutely no reason why you can't push it back up again, which you've done already. So I think maybe get you to have another look and think, is he staying on as well as he can do? Could you help him by taking a more leaning back position to get gravity on your side, or do you need to support your wrist to keep him on? And that's sort of looking at the sort of the first instance. Anything you can think of to add to that?
Well, I think it's a bit of a chicken and egg situation, isn't it? Because you're worried about your supply. I think 6 weeks is quite a milestone in breastfeeding, because you tend to kind of establish your supply at that point. And so often breasts start to feel less full, and that might be what you've experienced, and then you've been worried because you think that your breasts aren't as full as they should have been. And then you start introducing more bottles, and if you introduce more bottles, it often reduces the amount of suckling or stimulations, and then that can reduce your milk. So you're on this sort of cycle of going through what you're going through. And actually, if you just up, as Alex said, just up your stimulations, you might get back to where you were, and then you can start to reduce the top-ups again and challenge them. But you have to work really hard for about 4 days just to sort of kick-start it again. And doing compressions again when you're breastfeeding, that will kick-start your supply a little bit. It will encourage deeper suckling and also stimulations to make more milk, plus the pumping. And it might be worth having a chat with us just to see what else is going on. Sometimes you might have had a period. Some mums start really early on, or they're ovulating and don't know you're having a period yet. Sometimes that happens. Sometimes you start on contraception, and that sometimes knocks your supply down as well. So it's not always just something you're doing. It could be external factors as well. So have a think about all of those things, and see what's happening. Maybe write down a pattern. Do some pumping, notice how much you're getting out, and over 4 days see if that increases. Notice how long the suckling's for, and is he transferring milk better over a period of days, and that will be the sign that you're seeing more milk, and the poos will go up again and things like that. So, but it is a chicken and an egg when you start to give more bottles. It sort of dampens down your supply a little bit, because your baby's happier if they're fuller all the time, and they have much larger volumes than they may have had when they were just breastfeeding. So it's a confidence thing on your behalf as well, because you've lost confidence in your supply. So it's backing that up yourself, and it's investing in that, which is the hard bit. Pumping is really, really, really hard, but it works.
Yeah.
And more feeding, it works. So if you think he's hungry, put him on the breast again and then top him up after the second one, rather than giving him a bottle straight away, and just see if those stimulations over a couple of days will kickstart your supply as well. The more you take off, the more you'll make, is the motto.
So yes, keep in touch, Claire.
Talk to us.
Yeah. Kimberly said, good afternoon, what's the benefit of expressing colostrum before birth? Well, there's no obligation to do it. We just find there are quite a lot of people who choose to do it. Women who have got risk factors, so for instance a mother who maybe has diabetes, we would be highly recommending her to do it. And the reason for that is that after the baby is born, we need to check that baby's blood sugars are okay, because if you imagine the mother hasn't been able to regulate her own blood sugars, and that's an impact on the baby. So we end up taking blood sugars from the baby and checking what their blood sugars are. And it's quite normal that they'll go up and down. But if they go down quite a bit with a mother, if a mother's a diabetic, it might go down a bit more than we would hope. And we need to give additional food. The best food we can give is colostrum. So having some ready is a fantastic buffer and prevents us having to give anything else. And nothing brings up a blood sugar better than colostrum, and preferably mother's own colostrum. So that's why we would be doing it. If we know a baby's going to be born a bit early, kickstarting that milk supply, or having something ready in advance is always beneficial too. But unless you've got a risk factor, there's no obligation, no need for you to do it. Some women like to have a go just so they've learned that skill before they've had a baby, because once you've had your baby, it's quite tiring. I mean, it's not called labour for nothing. It's hard work. Women are really tired after they've had their babies. And you know what it's like trying to learn a new skill when you're tired. It's not the best time. So learning a new skill when you're feeling a bit fresher, and I know you don't feel terribly fresh in these last weeks, but when you're feeling a little bit fresher and you've got time to concentrate on it, can actually be really helpful for many mums. But there's no requirement on you to collect. So maybe just learning the skill.
Or practice and do it once or twice, and that's it. You don't have to collect it. There's no obligation at all. But I think that the bottom line with all of this is that we're protecting exclusivity, and we're trying to protect mums from giving their babies anything other than breast milk. And that's the best practice for every baby and every mum, is that we protect babies with exclusive feeding. And that means that they just get colostrum and just get transitional milk, and then they get mature milk, and they make enough to feed their baby, so they don't need to give their baby anything else. And that's what your baby's expecting to be fed in the first 6 months of its life. So learning a skill and making sure that you protect your supply by having that skill. So if you can't feed your baby frequently, or the attachment isn't great, having that skill will then ensure that you can get milk out of your breast. It's kind of like emergency care. It's your go-to if you're struggling, and you will always be able to get, if you have a good technique. And there's many people that don't get good techniques because they haven't been taught, or they haven't they haven't quite got it. They're not not everybody is as dexterous as everyone else, and some people can't do things with their left hand or their right hand, and it makes it more difficult. So learning to do that when it's outside of all the other constraints of having a baby means that you protect your baby with exclusivity, that you only give exclusive human milk to your baby. And that's what we're aiming for, protecting your baby, if that's what you want to do. And we want to protect you and be your advocates in that one. And one of the things is that if you hand express, you can always give your baby exclusive breast milk or colostrum, and that's where it.
How amazing breast milk is. When they covered what breast milk is, happens with breast milk, how it changes the whole way through. It starts as colostrum, and it's all these protective properties, and then it changes constantly, because as the baby grows, the body knows how old that baby is, and it changes the constituents in the breast milk to meet the baby's needs. That you as the mum will pick up if there's any bugs or viruses or whatever in the around you, and your body reacts to that, starts to produce antibodies instantly.
Within 20 minutes, you start to make antibodies. If someone sneezes on you, your breast milk will start to make antibodies to protect your baby within 20 minutes. It's so amazing.
That's why we like babies and mummies to be kept together, because if your baby's not with you and comes into contact with some form of pathogen of some sort, and you're not together, then your body doesn't know to make it to protect your baby. But it just carries on changing all the way through, right up until you stop feeding. And it's beneficial to whatever age. And WHO recommends 6 months of exclusive breastfeeding, and that means just breast milk. and then alongside other foods up to the first year and up to 2 is still beneficial. So in fact there's no limit on how long you would want to feed. So we know that breast milk is amazing, and that's why learning how to hand express before you have your baby can be helpful. Having a buffer if you think you might run into some problems can ensure that you only ever give your milk or donor milk in the first few days whilst you build your supply up, and it enables you to be exclusive throughout before you normally add other things in.
Yeah, that's why we're here. We're protecting you and your baby, and it is unique, and it is a moving form, breast milk. It's a living form, and it changes constantly to your needs and your baby's, not your next door neighbours. And the volume.
Well, unless they've sneezed on you or something.
Or you shed milk, which is another story. But if you look at the amount a baby gets at 6 weeks, it's the same amount as they get at 6 months. So the volume in the breast doesn't change, but the composition of the milk does. So babies don't have things like amylase in their gut before 6 months, so they're not prepared for having solids before 6 months because they can't actually digest the food. It hasn't got the enzymes to digest the food easily. So the body is preparing itself for lots of different things, and it's all in the different stages of the breast milk and feeding. There's a reason for them all. So it's absolutely unique, and it's made for your baby, and that's the important thing to hear.
I think the final thing to say about clostrum, those who are talking about Kimberly about doing it, and many mums do, is that if you are going to do it, please don't bring lots in with you.
Yeah.
I think we reiterate this every time. Yeah. Please don't bring lots of clostrum in with you. The reason for that is we just don't have the storage capacity for it, and actually it sadly sometimes goes for a walk and we can't find it. So bring only, if you do express and you are lucky to have a fair amount, just bring a very small amount in, a syringe max, 2 syringes maximum, no more than that. And if you need more, then we'll have to ask somebody to bring it in. But
you can hand express when you're in hospital.
Yeah, exactly. So
if you're in labour, you can hand express and use that because it's okay for 24 hours. And I said it before, but hopefully your labour isn't any longer than that. But if you hand express in labour, it'll help with your your labour. It'll help speed it along, make you have nice contractions, but also you practicing as well. But with all those surges of hormones and all that oxytocin going on in labour, you will have colostrum as well. So take some in syringes and have that ready. That's the best way to do it, rather than bringing it in and losing it.
Charlotte's come on here. Sorry, I'm moving on, but I hope that's okay, Kimberly, and I hope we've answered your question. Probably a bit too much, actually, knowing us. Sorry about that.
We are a bit nerdy, aren't we? I'm sorry about that, yeah.
Charlotte's come back again, our frequent visitor. She's wondering if her and her fella have another baby next year, what will the rules about appointments and scans be? Charlotte, let's be honest, this time last year we had no idea what we were going into, and I cannot tell you what's going to happen. We thought it would be
a few weeks, didn't we?
Yeah.
So pass.
This time last year we cancelled all our breastfeeding clinics, and they were closed until September. So we've no idea what's going to happen.
And still no visiting for partners, so we are a year down the line and this is where we are, so pass.
I'd love to tell you, but we've no idea. So I think the more that the vaccination is rolled out, the lower the levels, the more things will open up. But the hospitals, I think, will carry on being extremely careful.
Yeah. I think we'll be wearing masks for a long time.
Yeah, we had that conversation today, didn't we? I think we'll all be in masks for a very long time. I know we're not wearing them, but
they're on the table next to us.
Yeah, absolutely. We will be in a minute. Molly has come on and said, when breastfeeding, do you have to watch your diet as you do in early pregnancy? You can eat what you want, can't you? Yeah, no forbidden foods. So,
limit your alcohol. But
you can have the odd glass.
Have the odd glass, but not lots.
You'll know about it if you have lots, because if you haven't been drinking during pregnancy, you'll be knocked out after half a glass.
You will.
So
tired.
Yeah. So there are no forbidden foods at all. And some people, I've heard all sorts of things over the years. I've heard people suggest to be oranges and strawberries and Italian seasoning and all sorts of things. We could just go on and on. But actually, you know what? Unless you really, really see a link, the likelihood is it's not. And the wonderful thing, and we've talked about how long you feed for, the wonderful thing about breastfeeding is your milk is constantly changing, as we've mentioned. The taste of your milk changes. And this means that because it's all in reflection of what you're eating. This means that when a baby gets to 6 months and starts trying other foods, it's not completely new to them, and they're really, many babies that have been breastfed cope perfectly well with complementary foods, solid foods, because they're used to the idea of different tastes. And I think in research that they know, we find that the babies preferred garlic flavoured to vanilla.
They tried vanilla and garlic, and babies preferred garlic to vanilla. So
it's quite amusing. You wouldn't have thought so. I mean, human milk's really sweet to start with anyway.
But it also changes colour a bit. If you have lots of carotene and things, it does become a little bit more orangey. It does change colour. So as your skin does, if you have lots of carotene. So it's unique.
Yeah,
it's unique.
No. So
I can't keep saying that, but we do.
So no concerns there. You can look forward to going back to that deli counter, Molly, when you've had your baby. All right. Annie has said, how can I increase the supply of my left boob? I have plenty of milk, but my right boob has always been the bigger one. And even when producing milk, my right one always has more of a supply. Well, that's quite normal, isn't it?
It's not unusual to have asymmetrical breasts, and maybe you've got slightly less glandular tissue development in one of your breasts to the other, so the production is a bit less. It's not abnormal at all, and mostly you cope with that in the fact that you might find that if you start feeding on the side that's slightly less production for a little while, and then go to the next side after that, which you probably would have done spontaneously, because I think most mums know to do that. You might find that you can up it, or if you do a little bit of pumping after feeds, it might kickstart it a bit, but it just might be that physically the glandular tissue in your breast isn't so prolific as the size that's slightly larger, and that might be all it is. But most people have got asymmetrical breasts in some form.
Absolutely.
And that they have different size breasts, so it's not an unusual thing. And the other thing is that you often favour one side over another, and so you might have unconsciously done more stimulation in the early days on one side than the other side, and that might be all it is, in the fact that it's just delayed the production of milk in one breast slightly to the other. And we know that there's usually more milk in the breast that your baby's had its first feed from when you're in the labour wards, perhaps, and you feed your baby on the labour ward, and then you might do another feed on that side again if you've got a drip in your other hand or whatever, you're more dominant with your right hand and you're feeding on the left. You might find that your left breast has more milk in initially, because you've unconsciously just stimulated it a little bit more often, and it was the first feed that you did in the first hour. And that often is all it is to impact milk production, and it just shows how powerful those early feeds are in milk production when your milk comes in. And it shows that, that if you've had that early feed on one breast but not on the other, the breast that you fed on in the first hour has more.
We just know that those early feeds, those early feeds are so important.
Yeah.
Just to reiterate that, because we meet mums who have had plenty of better breast changes during pregnancy, no risk factors whatsoever, and then they go and struggle to make milk after the birth, and then you find out, well, there's been, maybe that baby didn't stay with them when they were first born because they had to go off to the neonatal unit, and maybe they didn't start expressing for a few days afterwards. And that's really difficult, because the body is expecting you to tell it that the baby has been born, and the key to that is the baby's at the breast. So if your baby's not at the breast, if there's any delay in getting the baby to the breast, you really need to be telling the body the baby has been born and that you start expressing ASAP. And on the neonatal unit, what they will try and do is get mothers expressing within an hour of birth, because they know it makes such a difference to the long-term milk production if they don't do that, and it can really, really affect how much milk a mum produces. So for those of you that haven't had a baby yet, if you have any reason that you're not getting your baby to the breast in the first hour or so, please start expressing and carry on expressing, because
do it yesterday, not tomorrow.
Your body needs to know, and it is heartbreaking if you want to be breastfeeding and you do not produce enough milk. You could put a baby to the breast, but if the milk supply is not there, then actually you're still going to have to give something else, which is really sad.
So, I had a conversation in clinic this morning, and a mum came to see me with her second baby. Amazing, doing really well, but she struggled with her first, and she said, we were talking about time critical and the early breastfeeding days, and she had no idea that you have sort of 2 weeks with a window, well, actually 3 days to 2 weeks it is. So it's time critical that time. And if you have got a window of 3 days, and then after that your window shuts down, anything you do after that does not produce the same volumes of milk. It can be up to 14 days with most mums, but we don't know who they are and who it's going to affect. So we assume everybody could shut down at day 3, and that the plug-in of the breastfeeding receptors, in the breast and milk production receptors, if that's shut down, nothing you do will make more milk easily. And we see many women in clinic that come because they don't have enough milk because they didn't do that in the early days. They were tired, their baby was separated, they were poorly, they didn't know it was important. And the thing that they all say is, I wish I'd known that. Of all the things I wish I'd known that I only had a few days to make milk in the early days, and then it wouldn't happen, because the heartache of pumping and triple feeding, you're feeding, you're topping up, and then you're pumping day after day is absolutely really difficult. It's so traumatic to do and so time consuming, and it's such hard work. And if you've known that on day 0 you have got to get at it, and even when you're feeling rotten, you've got to do hand expressing or feed your baby frequently, and it's the more you frequently stimulate your breast, the more you will get milk. So 2-hourly hand expressing in the first 3 days is brilliant. Certainly in daytime hours, and a couple of times at night as well. If your baby's sleepy, don't make the most of your baby being sleepy in the first 24 hours. Make the most of your baby being sleepy by hand expressing, because when your baby wakes up and it needs it, when they've got over the birth and everything, you will have your milk ready for them. But if you're having to go home with extra bits and pieces and order pumps and get all of those things in place, it's really, really stressful for parents and families. So really get on that hand expressing from day 0. Just don't take your foot off the accelerator, because you get payback. In 2 weeks you've secured your supply. And you can do anything with breast milk.
And you can't do that later.
You can do anything with breast milk. If you can't breastfeed and you haven't got breast milk, it's absolutely soul destroying for everybody. So, get on it, do some hand expressing, learn the skill antenatally if you can, so that you get straight into it when you've had your baby, and it's not something you've got to then find someone to teach you and they're busy. Just make sure you know how to do it before, and it will make a big difference. Big difference.
So moving on, so good luck with that. So this is Annie's question as well, so she put a second one up. My period has come back earlier than expected, baby's 2 months and 2 weeks. During the time my period is, my milk supply lowers, but I've tried giving my baby formula during this time, but she has a milk protein allergy and doesn't like the formula that's been prescribed. More breastfeeding. Just put it back to the breast more frequently.
And once you've ovulated, or when you've had your period, the milk will come back up again.
So the baby will feed a bit more frequently.
They'll self-regulate.
Yeah, and that will help push your supply as well anyway.
Bad luck though, isn't it, after 8 weeks? It's not what you're told in the books, is it?
No.
Especially if you're fully breastfeeding.
Yeah, so that would be great if you could just pop your baby back to the breast more frequently rather than giving her anything else. And she'll help push the supply anyway.
It will reduce if you start introducing bottles. That's the thing. It just breaks the cycle of feeding, and your body says, oh, I don't need that much anymore. So if it's dropped anyway, and then you drop again because you're giving a bottle, you'll find that your supply drops off even more, and then it's a vicious circle again, which is what we talked about a minute ago. So drive it. The more you take out, the more you make. And then you'll find when your period's finished, you'll be bursting again. And it might be a good time, if you do then get lots of milk, you could collect a little bit and put it in the freezer, and if you are worried, then you've got breast milk to give us a top up.
What a brilliant idea.
But just keep going, skin to skin, skin to skin. But if you tend to drop 6 hours between feeds at any time, it can increase the risk of ovulation again. We always say if you're using breastfeeding as a form of contraception, which is not something we do in this country particularly, if you introduce anything else, or you have more than 6 hours between a breastfeed in the first 6 months, the risk of ovulation is greater. So there's a chance that you could get pregnant again if you aren't breastfeeding exclusively. And also remember that you ovulate before you have a period, so you don't always know that you're ovulating until you're pregnant. So you know, we do see people come back after 10 months as a result of that. But
Absolutely.
if you have a long break between breastfeed, so more than 6 hours, or you're introducing anything other than breast milk, then the exclusivity is broken and there is a risk of pregnancy.
So, Annie, I hope that's helpful. Emma has said she started doing some antenatal hand expressing. I'm getting a couple of mils off now. It's become
great.
quite pale and less sticky than when I started. Is that okay? Absolutely.
It's not going to be milk because you've got a placenta still.
Yeah. So yeah, it's not going to change. Don't worry.
It's not going to change, and it's not going to make you breastfeed any better in terms of volumes and production, but it will give you a better skill.
Yeah.
It doesn't increase your chances of making more milk if you do or don't do it. That's very being very precise about that. You know, it's not going to. You don't have to do it to ensure that you get a good milk supply, but it will increase your chances of expressing well if you have that skill.
And it will vary in colour, and it's quite interesting because when we support mothers with hand expressing, when you sit there and teach them and they start doing it, you'll even notice, because I'm sure anyone who's been watching this has heard it before, but the nipple is more like a watering can than a hose. So it's got lots and lots of little holes, and actually when you're helping someone with hand expressing, you're watching them doing it. We don't do it for you, by the way, you do your own.
Yeah.
And we're watching them doing it, supporting them. You will find that from the different paws, they're called nipple paws, it will come and it will look different from one paw to another. And it's the same breast and you're doing it at the same time, and yet one paw might have much more yellowy, got orangey colour, and others might be more clear like you've just described, and that's really quite common, that it will look different even from the same breast from different lobes. So yes, the fact that it's changed is not a concern at all, and well done you for having that skill, and how wonderful you've got a few meals already. That's wonderful. So good luck with that, Emma, and I hope that reassures you. Justin's put a question up. Thank you for your helpful advice. My health visitor watched me breastfeed yesterday and said the latch was good. I just need to keep breastfeeding to establish my milk supply. I was having difficulties with the latch in the first few weeks. Open the rest. In the first few weeks, my baby is now 5 weeks old, so I started using nipple shields, which really helped. But by then, my milk supply decreased. Would you suggest lecithin for my blocked milk duct, or is that only a preventative measure? I don't know what the latest feeling is about it.
There is some evidence because it's quite greasy and it's oily, and the whole thing is that it makes the milk in the ducts a little bit more oily, so they don't tend to stick. But that, I think, good positioning and attachment is more important, because why are you getting the ducts blocked in the first place? And quite often that's poor attachment. If your baby's not moving milk easily, sometimes you get plugged ducts. So is your latch really deep? Are you in pain anywhere? Can you get it checked again just to make sure that the attachment is deep enough? Is there room for improvement? Answer is probably yes, because we always say that. But it may help if you are getting lots of plugged ducts, but the reason behind is that it makes it slightly more oily, and so it doesn't stick. Some people say put something like organic coconut milk or olive oil on your nipples as well, but take a little bit off before you feed. Don't do it just before a feed. And that sometimes softens the ducts into your nipple, milk ducts. But who knows? It's not heavily researched as far as I know.
No, not that I'm aware of.
It's sort of quite anecdotal, but it does tend to help some women.
So
check your positioning.
Yeah, I was just about to say, just reiterate positioning.
We always go back to that. I know it's very boring, but that is, and actually at this point in time, it's the hardest thing to do because there's not much help around face to face at the moment. But check your positioning, because that's crucial, absolutely crucial. Get someone else to check.
Yeah, if you can do something online, they'll be able to check what you're doing.
Yeah.
I think we've all got very adept at helping with positioning attachment online now. So yeah, that would be something you could be doing. Is just get someone else to have another look as well. It might be something, just a tiny millimetre of a difference can make such. There's a change of that, like that can make such difference for the mums and babies' experience. So unfortunately, there are some women who just really seem to struggle with them, don't they?
Yeah.
Moving on, Jessica said baby Rory is 5.5 weeks old and we had a difficult start. He wouldn't latch during his first week and lost weight, and I had to express milk for a few weeks. I was then eventually able to get him to latch using nipple shields. and we now are exclusively breastfeeding. Well done, using shields.
Amazing.
Every few feeds I try and remove the shields, but he won't latch. He opens his mouth wide, but he won't close his mouth around my nipple. Is it too late to get him to latch without shields? No, it's never too late.
He'll do it when he's ready, not when you want him to. You can, one of the things you can do, because the trouble with the nipple shields is it feels different in their mouth and it feels quite firm, and they're not used to the softness of a big round breast in their mouth, and it doesn't feel the same. But you can sort of make a sandwich just for a little while with your fingers. Can you see that? So you sort of make a sandwich like that, and it firms this part of your breast so that it feels like a nipple shield in their mouth. And then you just, when they go on, you just hold it there for a little while until they get sucking. And sometimes that's all you need to do. I think the other thing is to get him to suckle for a little while, get mid-flow, and literally have the nipple shield on your nipple, and then you literally just whisk it off. And I usually stick it above when I'm showing someone how to do it, and just stick the nipple shield above on the breast, and then you literally put your baby straight back on. You take it out of their mouth while they're sucking and pull it up, and then you put them back on while they still almost haven't breathed, and they're mid-suck, and they're so hungry and they're in full force with breastfeeding that they don't notice that you've got the breast in their mouth without a nipple shield on, and then before they realise that you've done it, they've been suckling for about 5 minutes. But you can do a little bit of just making the breast a little bit firm around the nipple, and that sometimes is all they need just to reassure them that it's okay. And also you can get them to sort of gape by putting the nipple shield round the side of the nipple so they get that plastic stimulation to
Sounds
open
like he
their
opens
mouth.
his mouth though. She says he opens his mouth.
Doesn't close
Opens it
it.
wide, but
Doesn't close it.
Yeah.
So just make your nipple a bit firmer and see what happens.
Yeah.
And you can also do that when he's a bit sleepy.
Yeah.
And sometimes he will bypass his conscious mind and just do it because that's what babies do, you know.
And we'll go back to our other default, skin to skin. So that's our other default, is always, lots of time skin to skin, reminding the breast is a lovely place to be, and it doesn't need a piece of plastic to feed from your breast. So,
but he'll do it when he's ready. Nobody else will do it.
No.
He will do it when he's ready,
No.
and the time that he will do it is when you've forgotten to take them out with you, and you have to feed him, and he'll do it.
But I will say, because we do use shields in clinic, we do actually end up, we will actually suggest them in instances where we can't get babies to attach any other way. We will do that. We would never do it in the early days. Using a shield in the early days is not helpful. It will absolutely and utterly inhibit your supply. So please don't use a shield in the first few days after you've had your baby when it's colostrum. It is not a good time to use it. But we do use it when we've exhausted all other avenues a few weeks down the line. And actually,
and you're breastfeeding.
I was just about to say, much as it is using a shield, and that's a fact to have to carry them around with you, but your baby is still breastfeeding, and your baby is still getting milk from your breast, and is getting all the benefits of being there. It just so happens there's a little bit of plastic in the way, but how fantastic, how wonderful, how much better than any other alternative. I think it's wonderful.
I mean, you just have to make sure that you've got plenty of milk, because they do get a little bit less through them. So if you have a good supply, your baby will be awash with milk with a nipple shield, but if you have low supply and use a nipple shield, you'll get less. So you have to make sure that you've really got a good supply if you're using them as the only source of feeding. It's not, if you have got low supply, it's not always reliable just to feed on nipple shields. So you've got to look at all the other signs as well. So is the nipple shield full of milk? Can you hear that suckling and swallowing, that really good glugging that babies do? Have you got lots of wet and dirty nappies, and is your baby gaining weight appropriately? So 20 to 30 grams for your baby a day, and are they doing all of those things? And if they're not, then you've got to look at whether the production of milk with a nipple shield is quite enough, and it might be that you need to back it up with some pumping until you've secured that supply.
Okay.
Well done.
Yeah, I think you should say
panic.
you're breastfeeding, how wonderful.
You'll do it maybe when he's 8 weeks, maybe when he's 3 months. Might not do it.
Maybe tomorrow.
Might do it tomorrow, might do it this afternoon.
Carolina has been on here before, I recognise her name. She just wanted to ask, how thick is the milk in the breast towards the end of feeding? The milk that's supposed to be fatty, is it thick as clostrum, or is it more like liquid? I'm just wondering whether it gets into the bottle when I'm using a pump. It will.
It's not that thick. No. It's just slightly whiter.
Yeah.
So it's more sort of bluey white, clear, when you get the first milk, and then as the feed goes on, it just sort of gets a bit whiter and it's got slightly more fat in it. That's all. There's fat all the way through your breastfeeding, and what happens is you've got in the ducts, there's lots of globules of fat inside the ducts, and when your baby suckles and there's lots of milk in your breast, the globules are pulled off as the baby suckles, and as they suckle more, there's more globules of fat removed. So they're sort of stuck to the sides of the milk duct. So the less volume of fluid in the breast, the more they suckle, they get more fat out of it. So there is fat all the way through the milk, but as the volume of milk goes down, then the fat gets higher. And actually in the evenings you have 18% more fat in your breast milk than in the mornings.
Amazing, isn't it?
In the Caucasian culture.
And then there you are sitting there thinking, my word, I don't feel like I've got anything, because that's what women will feel. And the baby's feeding and feeding and feeding, and mums are going, what am I giving my baby? You're giving them thick, creamy milk. Yeah. But it won't look like clostrum, don't worry.
It definitely looks like milk, and it does look a different colour. It will be different if you hand express at the end of the feed.
Right.
It's very clever, isn't it?
Sophie has said, hello, my baby's 4 days old, but is it normal for when he's latching on to be painful? It stops a few minutes after, but just the initial latching on is painful. Yes.
So basically, if you've got slightly sore nipples from initially feeding, and as the nipple goes over the top of the roof of the mouth, it sort of rubs a little bit until it gets into the right place. And we always say wait about 10 seconds, don't we? And if it's all fine after that, and your nipple looks a good shape when it comes out, so it should be the same shape as it was when it went in, but slightly longer maybe, then it's fine. But if it hurts all the way through...
Yeah, because the one time a baby actually sucks, because most of the time I'm going to borrow the breast. When a baby's feeding, they're on the breast and they're doing this. You're using their tongue to strip the milk. There's negative pressure as well, they are sucking, but not to the same extent when they go on. So when the baby goes on with his upper lip just sitting the nipple, the baby will literally suck your breast to the back of the mouth, so that it's sitting up against the soft palate. When the baby does that, they reckon that the baby extends the nipple and areolar complex, all this section here, up to twice its normal length. So if you've got any damage, that is not going to be comfortable. But once it's there, it should be comfortable.
Doesn't move.
Because the nipple sits in against the soft palate here, and the tongue is doing all the work and pushing the breast up against the soft palate. So that's why that initial suck hurts, and then it shouldn't. So which is why we say count to 10 slowly. If after 10 it's easing, you can feel it's really lifting, that's fine, it's definitely getting better, fantastic. If it's not improving at all, take the baby off, have another go, and if you can't get it right, get help. And you'll still be under your midwives, because you're only 4 days old, so your midwives will be caring for you up to at least 10 days. So if you are struggling and things don't get better, or that pain lasts longer, get your community midwives to come and visit you, or you go and see them and get some one-to-one support with that. But if it's just the initial latch, that's very normal. Very, very normal.
Is he pooing every day? Has he pooed yesterday? Has he pooed today?
Yeah.
Lots of wet nappies. Nice yellow poo should be happening from now.
Yeah.
And if that's all happening, then everything is right. If he stopped pooing, it might be that he's not quite on the right place, and that he's dropped a little bit more weight than he should have done. And they'll tell you that tomorrow when you see your midwives tomorrow. I hope that helps.
Yeah, so hopefully you'll see yellow poos today, nice 4+ heavy wet nappies, and that'll be a good sign. Louise has said, I expressed colostrum and froze it in ice cube trays prior to birth, now breastfeeding and occasionally feed expressed breast milk in a bottle. Is there any benefit of using the frozen colostrum mixed in with the breast milk, or can I donate it?
Ooh, there's a thing. They love donated colostrum. It's so precious. If you feel that that's what you'd like to do, I think they'd be very, very happy for you to donate it. We do offer it to the very, very premature sick babies on the neonatal unit in the early days. So a gift of colostrum is an amazing thing. But it is also lovely for your own baby, so it's entirely up to you. But if you have some and you feel that's what you'd like to do, then you can contact Amanda Wood at the Milk Bank. So the details will be on the infant feeding page of the Women's Centre website. You've got access to that, or if you just put in onto their search page, Milk Bank, it'll come up with the details, and there's an email address that you can email and ask if you can donate. and that's as simple as it is. And they send a courier to pick up, and they give you all sorts of bits and pieces, and I think you have to have a blood test. But if you don't want to use it, and that's what you'd like to do, then donated colostrum is an amazing gift. Absolutely.
Yeah, fantastic. And it will be used on the neonatal unit.
Yeah. For the really, really preemie babies that they're having.
So that's fantastic. If you were to use it for your baby, the only thing to say is that it's a laxative. Colostrum, that's the perk.
Breast milk's very runny, isn't it?
So you just expect even more stools. But it would be a
You'll
good
get more poo.
Or save it for if your baby's not feeling too good, because that'd be, if your baby's got a bug or something, that would be a good time too, because it's chock-a-block full of antibodies. Every antibody you've ever produced in all your life. So it would be like a item of medicine for your baby. So you've got plenty of choices there, but yeah, hopefully you can see what you fancy doing. Right, Olivia has said, what are the current guidelines on having the COVID jab? I'm 40 years old and baby due in May. I've been told I shouldn't have it whilst pregnant, but can I have it once baby comes and I'm breastfeeding, or should I wait until I finish breastfeeding to have the jab?
I think current guidelines are that unless you're not a frontline worker and pregnant or breastfeeding, then you are not offered the COVID vaccination. If you go to the Royal College of Obstetrics and Gynecology, I think it is, isn't it?
RCOG,
yeah. They announce changes all the time, and I haven't noticed any changes, but somebody did think that they changed them today. So it may be that they have changed and we haven't been notified, but the best place to go is somewhere like the RCOG, onto their website, or look at the Women's Centre page, the John Radcliffe Hospital latest information for women, that will also be linked to, and the Royal College of Midwives also produces documents on it. So, but we take our information from the RCOG. So have a look on their website and see what the latest information is for pregnancy and breastfeeding women, because they may have changed it. It is changing all the time, but as far as I understood, it's only being offered to frontline workers at present.
Our one of our consultant obstetricians, Brenda Kelly, Dr. Brenda Kelly, she's done a couple of Facebook Lives like this about it as well. So you can have a look at those. Obviously, be aware when they were done.
Yeah.
Yeah. So, but it's but
they'll be on YouTube. They'll be
yes,
on
they are.
The, OMVP YouTube page.
Yeah, you'll be able to find it. So
all of the links that we've done,
yeah.
all of the sessions that have ever been done by OMVP, Ask the Midwife sessions, all of that is going to be it's being recorded on YouTube, so you have access to those. But it's Brenda Kelly, but they may be out of date now.
Yeah, so it's worth having a Emma said, Emma's come back. She was the one who was saying that her colostrum looks a different colour, and she said it's reassuring. Charlotte Bells said, my baby will be 3 weeks old this Saturday, and within the last week on almost daily basis for one feed each day, usually early nighttime feed. She's finished, I've changed that nappy. Okay, I'm getting myself in a muddle here. Almost daily basis for one feed each day. Finished feeding, I've changed the nappy. She's inconsolable, crying on off for around 3 hours solid, arches her back, brings her legs up to her stomach and is sick a few times. Tried patting her back, keeping her upright, rocking her, but nothing seems to calm her down. Friends, family suggested different issues, e.g. colic, trapped wind, lactose intolerance. Do you have any advice, please? She's breastfed, we've been using Infocol for the last few days, but it does not seem to be making a difference. I don't think there's any research to support Infocol, to be honest. That's not something that we would normally be suggesting.
Lactose intolerance is rare because breast milk is lactose. And so babies would be very, very poorly if they had lactose intolerance. They wouldn't tolerate anything. They'd be in Great Ormond Street. So, they would be very, very poorly. So lactose is probably not the answer.
What your friends might be thinking about is cow's milk protein allergy, and that would be happening all the time. It wouldn't just be specific periods of time. So, from that point of view, cow's milk a baby that's affected by cow's milk protein allergy, and again, that is extremely rare. It's really not that many babies.
They wouldn't be gaining weight, they'd be quite inconsolable.
You would have
great green stools, very explosive green stools.
Possibly with streaks of blood. So your baby would be, may
have a
have
rash on its face, might have a very, very sore bottom. I mean, the thing that is classic, and I'm assuming this is your first baby, and the fact that you're asking the question, you know, you haven't experienced it before, is sometimes what we call lactase overload.
Yeah.
So basically you're feeding your baby on, off, on, off, on, off, and because they're crying you think they're hungry and you're feeding them more, and then they get more food and they get more lactose, and the enzyme in your baby's tummy is lactase, and that breaks the lactose down into stuff that can then be absorbed and broken down to get nutrition and calories. And if there's too much lactose going in, so if there's too much of the breast milk going in, the lactase, which is the enzyme, can't digest it all at the same time. And so what happens is the byproduct of that is like hydrogen peroxide. It's really fizzy, and because you've got hydrochloric acid in your baby's tummy, it's not as bad as it sounds, but every baby's tummy's got hydrochloric acid in it. And this byproduct is really gassy and creates this fizzy in their tummies with explosive poos and tummy ache and rumbling, and you know, they are very upset. So you know what happens is you get into this cycle of lactase imbalance where it's really hard to get away from it. And so you have to make sure that the first thing is your positioning and attachment is right, so that you're getting the right mix of milk when you're feeding. You're not getting lots and lots of lactose from you know, on off the breast all the time. And that overstimulates the milk that's in the breast, you know, the formilk that the baby gets when it starts to feed, and then glugs, and then as the fat comes it gets less lactose in it. And if they get lots and lots and lots of the lactose, the body just can't cope with it. The lactase just can't deal with all of that at the same time, and you get this cycle of tummy ache and explosive poos and bringing its legs up and trying to be, you know, wanting to feed, and you think it's hungry, but actually it's just got this sort of build-up of gas in the tummy.
Well, babies love to suck when they're uncomfortable, so
yeah,
it becomes a bit self-perpetuating. So they'll suck because it makes them feel good, but actually it's perpetuating the problem. I'm just thinking, and you've mentioned all the sort of things you've tried to do to calm the baby. I'm going to add in a sling. Now, a sling meets baby's needs for closeness and comfort, and I know we talked about it before about positions that babies love. So slings are great, but also thinking about positions that babies like to help with, they've got stomach ache, so they love to have a bit of pressure on their tummies. This position works really well if they're feeling a bit uncomfortable in their tummies. And babies are no holds barred. If they're uncomfortable, you know all about it. They don't sugarcoat it. They're going to tell you all about it. So having them in this sort of position, you could even try, you know, sitting on a chair and having your baby lying on your knee, or lying across your knee. So any way that you can do that puts a little bit of pressure on their tummy if they're feeling uncomfortable is really helpful. I
should think 50% of the people listening to this are saying, yeah, that happened to me. That's what it is. That's exactly what happened to me.
It sounds like colic. It sounds like breastfed.
Colic.
Yeah, it's colic, but not colic in the way that not colic in the way that a formula-fed baby would have it. This is a breastfed baby, and this is where we would go back and, as Naomi said, look at positioning attachment. Really make sure you've got your baby going on, chin leading, head tipped back, upper lip just skimming the nipple. Make sure they're getting that really big mouthful, because we see this a lot, and it's like this.
And it's literally millimetres. You move your baby into the right place, and the right mix of milk suddenly starts to work.
Yeah.
And they don't get this overload of lactose at the beginning of the feed, and then of course, if they're hungry, you think they're hungry, so you give them more, and it makes it worse, and they're sick, and then you give them more, and then you give them more, and it just makes more and more and more lactose in their tummy, and they can't cope with it. And it just, so, you know, sometimes give the baby to somebody else and go for a walk. That's, you know, many times you go in the middle of the night for a walk, because it's always in the evenings that they do this, and it's when they cluster feed, and so you just perpetuate this overfeeding, and it makes it worse. So I always say, you know, give your baby a really good feed, make sure your attachment's correct, make sure your baby's clean and dry, and then offer another feed, and then see how it goes. If your baby is still hungry, then, you know, maybe take it for a walk. If you know it's had a good feed, it's had both breasts at least once, and it's clean and dry, take it away from you and take it for a little walk, or put your baby in a sling and go out, or, you know, go to another room and walk about with it, show the dishwasher, you know,
walk around the garden.
washing machine. It's really hard, but you've got to kind of break that cycle of overload of lactose, and then start to let those lactose lactase imbalance, and that is due to poor positioning often and overfeeding, and it can be resolved. But most parents get that one with their first baby.
And it's not going to be an issue in the future. This is not saying your baby is going to have, we see this a lot, and it does not mean your baby is going to have lactose problems in the future at all. This is not what we're saying.
It's just they're getting too much milk and not enough enzyme in their tummy to get rid of it.
Yeah, it's the sugar in the milk that they're getting too much of, and they need more of the fattier milk, which they get if they're on really well.
And the worst thing is that your baby will be putting on loads of weight because they're getting lots and lots of sugar. They're getting lots of that really great lactose, which is exactly what breast milk is, but they always gain weight, so people think, well, everything's fine. Your baby's gaining weight, it's pooing and weeing, it's fine, but he's really unhappy and you're really unhappy, and it doesn't have to be like that. Just get your positioning double checked.
And it often accumulates over the day, so you get a period of time when it's not good at all, because it's accumulation over the day. So what you're describing is really typical. If you need more support, get in touch with someone. Get in touch with us. Get in touch with OBS, Abingdon Baby Cafe or latch, any of us to give you some support on this, because what you're doing is a fantastic job. You're breastfeeding your baby, and we want you to continue doing that. And this is just a little bump in the road. Yeah.
I seem to remember 6 p.m. till 2 a.m. was my time. What I know now is a lot more.
Yeah.
I wish I'd known it when I have my babies, because it really does make a difference.
Yeah.
Really does.
My number 2 was like that.
Yeah.
I'm going to move on because I'm aware of the time, because it's 15:40. We're over. So yeah, we have a few more which we need to finish. So Charlotte, thank you, and I hope things get better. But do get in touch, get some help. Jessica said, thank you so much for your advice on the shields. I'll try all your suggestions and keep seeing if you'll latch without them. Brilliant. Good luck with that, Jessica. All the best. Sophie said, thank you so much. That's so reassuring. Brilliant. Carolina has said, thank you, I've noticed that when I pump milk in the morning it looks very watery at the beginning and then gets more white when in the evening it's proper white straight away. That's what we expect.
18% more fat.
So you're doing a spot on job.
Keeping them going through the night.
Freya's come back, thank you for your reply and advice, such good work you're doing. Thank you, Freya, and say hi to Noam. Dorothea has said, maybe this question already been on 36th week growth scan, can we get a photo? I'm really sorry, Dorothea, but don't know the answer to that one because we're the feeding team. You could perhaps ask your own community midwife or ask Wendy Randall when she does ask the midwives, but I don't know what they're doing in scan at the moment, so I'm sure they'll be able to answer that one for you. And Charlotte has come back, thank you very much for your advice. So Charlotte, good luck with that, and thanks to all of your fabulous questions. And
we missed you last week.
Yeah, are we here next week? Is there any reason we're not here next week? Are you on leave again next week? Or am I on leave?
You're on leave the week after. I'm on leave next week.
All right, okay. So next week will be happening. It'll be me on my own then. But we'll see what happens the week after. Oops, Olivia's snuck in here. She's come in and said, thank you, this has been so interesting, and thanks for answering my question. Absolute pleasure. Thank you for your questions. There would be no point in us sitting there if you didn't ask the questions.
We'd be very quiet.
Yeah. Thank you one and all, and I'll see you next week. I'll be on my own, so okay. All right.
Bye.